Imagine going to the doctor for a routine checkup, and then they suddenly tell you, we need to do a biopsy. For many people, that single word instantly triggers fear. Does it mean cancer? Is it painful? Should you be worried? But here's something that might surprise you. A biopsy is often the fastest way to get answers and can actually save lives. Today, we're breaking down what a biopsy really is, why doctors recommend it, and what you can expect if you ever need one. Stay until the end because understanding this simple procedure could help you or someone you know face it with confidence.
Dum, 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 dum. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
And Saturday.
Hi everyone, I'm Doc Fred Ting, medical oncologist, academician, researcher, and health systems shaper. And welcome to Everything About Cancer, kung saan tinatanggal natin ang takot sa pamamagitan ng tamang kaalaman. Now let's answer the big question, what is a biopsy? A biopsy is a medical procedure where a doctor removes a small sample of tissues or cells from the body so it can be examined under a microscope. Think of it like this. If doctors see something unusual, a lump, a suspicious spot, or abnormal test results, they cannot always tell exactly what it is just by looking at it. A biopsy allows specialists to investigate further and get a clear diagnosis. Many people automatically associate biopsies with cancer, but biopsies are used to diagnose many different conditions, including infections, inflammation, autoimmune diseases, and other health problems. There are several types of biopsies. First, a needle biopsy. A thin needle is used to collect tissue or fluid from an area of concern. This is one of the most common types and is usually minimally invasive. But remember, pag breast mass, dapat core needle biopsy. We don't really use fine needle aspiration biopsy anymore for breast masses. Again, pagbukol sa suso, breast mass, dapat core needle biopsy. The second type of biopsy is what we call an endoscopic biopsy. Doctors use a thin tube with a camera called an endoscope to view internal organs and collect tissue samples. The third one is a surgical or a tissue biopsy. In some cases, a small surgical procedure is needed to remove part or all of a suspicious area for testing. One question people often ask is, Doc, masakit ba ang biopsy? Well, the answer depends on the type of biopsy being performed. But remember that most procedures involve local anesthesia, which numbs the area. You may feel pressure or slight discomfort, but many patients report that it's less painful than they expected. Now, after the sample is collected, it is sent to a laboratory where a pathologist carefully examines it. The results help doctors determine exactly what's happening and guide the best treatment plan. It's important to remember that a biopsy does not automatically mean that something serious is wrong. It simply means your healthcare team wants more accurate information. One of the most powerful things about modern medicine is the ability to detect problems early. A biopsy can provide answers when uncertainty exists. And in many cases, early diagnosis leads to better treatment options and better outcomes. Knowledge is powerful, so while waiting for results can feel stressful, having accurate information is often the first step toward recovery and the peace of mind. So if you or someone you know has been told that they need a biopsy, remember this: a biopsy is not a verdict, it's a tool. It's a way to uncover the truth, replace fear with facts, and help doctors make the best decisions for your health. Sometimes the bravest thing we can do is take that next step even when we're uncertain. Every answer brings you closer to clarity, hope, and healing. Thank you for watching. If you found this video helpful, share it with someone who might need encouragement today. Take care of your health, stay informed, and remember, knowledge is not something to fear. It's something that empowers us. Always remember, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Thank you for watching Everything About Cancer with me, Doc Fred Ting. If you found this episode helpful, please like this video, share it with your family and friends, and subscribe to the channel so we can spread accurate and reliable information about cancer to more people. Don't forget to click the notification bell so you won't miss our upcoming episodes. And always remember, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Again, I'm Doc Fred Ting, and see you in the next episode of Everything About Cancer.
Dum, 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 dum. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
On Saturday.